Welcome back. The NHS is to launch an investigation into why people from ethnic minority backgrounds are more likely to be affected by COVID-19. In England and Wales, around 13% of the population are from ethnic minority backgrounds, though they account for 44% of NHS doctors and 24% of nurses. A reported 70% of the 54 frontline health professionals who died from the virus were from ethnic minorities. Well, last week, intensive care researchers said the group was disproportionately affected. They claim out of around 2,000 coronavirus patients, roughly 65% are white, 14% black and 14% from Asian backgrounds. While the last census in 2011 shows that just over 7% of the UK's population are Asian and just over 3% black. Well, Government Advisor Shadim Hussain joins me live now to discuss this issue. Hi there, Shadim. So is this issue due to high numbers of ethnic minorities working in the NHS?
Hi now. Yeah, I mean, we know that there is a significant proportion of the NHS staff. I believe something around 35 to 40% are from black minority and ethnic communities. And of course, this could have a relative implication on that. But the concerning factor, of course, has been that, 12 of the first doctors who have died are all BAME. And that simply can't be a coincidence.
Well, what other factors do you think ensure ethnic minorities are at risk?
Well, I mean, at least at long last, we all agree now that minorities are disproportionately affected by the virus. And at the same time, it's also essential that the government finds out and understands why that is and puts the necessary measures in place. At the moment, there's a number of possible theories to this. One could be socioeconomic disadvantage, could be pre-existing health conditions, such as diabetes. We've provided many such examples of multi-generational households, overrepresentation in high-risk frontline jobs, exceptional. We know about the NHS and public transport. So we just generally do know that BME communities, whether they be in professions or in working class jobs, are working on the type of job roles that are involving human contact. And this, of course, puts them at a higher risk.
Indeed. What could the government and also the communities themselves do to protect people?
Well, I think the communities have done a significant amount. I mean, I'm calling you here from Bradford, in my city here, and there's been a massive effort by an organisation I'm connected to, Bradford Foundation Trust. We worked in partnership with the Council for Mosques, various voluntary organisations, the NHS, our local hospital, led by Mel. There's been a great deal of interaction between these different organisations to ensure that messages that are put out by central bodies such as the NHS, such as the government, are actually translated into languages that local minority communities understand. So that's been the first effort. The second effort has been to ensure that the type of mediums that people use, it's fantastic that I get the opportunity to come on here on RT News, but not necessarily everybody is watching the RT News. So there's different news channels, different mediums, social media. So what we've done is we've taken the message to the communities to ensure that they get that information. I mean, one thing that I've advocated right from the start is, somewhat of a disappointment towards the government that they've not really made an effort to translate a lot of this information into other languages. And I think that has been picked up on a local level quite well.
Indeed. So communication is key here, isn't it? Shadim Hussain, many thanks for joining us. Thank you.
Thank you. Thank you.